Hey everyone, I wanted to share with you today my diagnosis presentation. I selected Angelman syndrome, which I actually experienced during my level 1 fieldwork at Children's. Just one particular time I got to work with a child with AS. You'll hear me refer to Angelman syndrome as AS throughout the presentation. AS, though, essentially is a neurogenetic disorder caused by problems with a gene located on chromosome 15 on the maternal side. Essentially, this chromosome is missing or damaged, causing problems in the functions and characteristics controlled by that particular gene. About 1 in 15,000 children are born with AS. It's still considered fairly rare, but moving on, the characteristics and signs and symptoms of AS are really, I guess, become much more prominent around the 6-month to 12-month time frame. These signs and symptoms range from severe developmental delays, motor issues, seizures. One of the most identifiable is they have a really happy demeanor. They're constantly smiling, laughing. They're easily excitable. I think it's just one of the most deceiving things because they have so many issues that they're dealing with, yet they seem like they're happy all the time. It's also interesting because AS is often misdiagnosed as CP or autism. Like I said, it's a little bit later after birth when these signs and symptoms become more prominent and they can diagnose it accurately. When you think about life limitations of a child with AS, they require constant care. Like I mentioned, they're dealing with these severe developmental delays. They're not crawling when they're supposed to be crawling or babbling when they're supposed to be babbling. They're not meeting these developmental milestones that we've all been, learning about over the past couple of weeks. They deal with severe speech limitations, and like I said, these motor issues. They're unable to walk, they're unable to balance. The individual I worked with at Children's, his means of getting around was scooting on his butt. I mean, that's just, he couldn't grasp the concept of standing, of balancing, of crawling, so scooting was how he got around. Along with, when you think of, many other diagnoses, early intervention, I guess earlier in life, essentially is going to increase their quality of life and allow them to reach their developmental potential. So again, earlier intervention is key here, because speaking of intervention, OT, PT, speech, and other medical treatments is really what this individual is going to deal with throughout their lifetime. They're going to deal with the anticonvulsants to control the seizures. They're going to be using melatonin because they have poor sleep patterns and behaviors. The mom that I worked with a child at Children's, she slept with her son every single night, and if he slept from 1 to 2 in the morning, then she just got an hour of sleep. Moving on to PTs, they're going to work on those motor deficits, focusing on walking and balancing. Physiotherapy is used to work on joint mobility, and then behavior therapy is used to work on attention deficits and hyperactivity. Again, the child at Children's, he had an attention span of 1 to 3 seconds. Literally, after 3 seconds, he was moving on to the next thing. This 60-minute treatment session was just exhausting, but that's just the nature of AS. And so really trying to manage and work with that is key. So moving on to focusing on OT treatments, we're really working on enhancing their independence and self-help skills for ADLs around eating and dressing. This is especially around the 6-month to 3-year time frame. We're also working on sensory processing, just so that we can help, provide them with the strategies and tactics to be able to balance those out and manage those. Then it's around the 3-year time frame. We're shifting our goals to more educational goals, working on pre-writing, the ability to grasp a crayon, things along those lines. So, interventions are key, and they're going to be used throughout the lifetime of this child as they continue to grow up. But I think it's really challenging, as a parent, just seeing it first and foremost in this particular child and this mom. It's important to surround yourself by a team of trusted doctors and therapists. This mom actually started a foundation called Wings to Fly Foundation, which is just a means for, providing and benefiting other kids and families that are dealing with Angelman syndrome within the community. So that's all I have. Thanks so much.